So, welcome to the Dr. Paul Show. I have the special pleasure of having one of my patients come on I've been my patient now for a couple of years. And I really want her to come on and tell her story because she has a really good story to tell and a subject that really is misunderstood and really we need to, during my show so far, we haven't talked about this issue. So if you could just tell us what happened. I think, like I said, my first visit was about 2 years ago. Do you share with us what happened that led to the visit?
Sure. So 2 years ago, my daughter was born, and about 3 months after she was born, I guess I kind of snapped. I just hit a point where um, I was definitely getting very invasive thoughts regarding myself and my children, and then I'd ruminate on those, and I couldn't let them go. And I finally told my wife about it, and it got to the point where I did have to be hospitalized for a few days just to make sure everybody was safe. Um, and I was diagnosed with postpartum psychosis at the time. And then while I was there, until before I could be dismissed from the facility, I did have to have a psychiatrist lined up. And my wife has been a patient of yours for several years, so she recommended you to me, and that is how I became your patient.
So going back, so I think your daughter was your second child, right? So you had your first child about, I think your daughter's now about 2 years old, and your son is what, 4 years old?
Yeah, he's four.
Yeah. So after your son, did you have any inkling? Did anything like this happen within a few months or so after he was born?
So it wasn't until I started medication that I realized that I have been in a form of depression since my son was born. I just thought it was my new mom personality.
Right.
Um, so yes, in hindsight, I did have it with my son. I just didn't realize it. I stopped wanting to go to my older son's football games. I stopped wanting to play football. When my wife and the older boys would come home, I would go upstairs and lock myself in my bedroom, um, and just try to avoid everybody. I wasn't pleasant to be around.
And when you were at the hospital, what did they discharge you with? What did they give you at the time?
Postpartum psychosis
What
was,
medication did they give you?
oh, they gave me Zoloft, and I think that was what they gave me originally. And then it wasn't until I got with you, I think like the day after I was discharged, that uh, we did Zoloft and Wellbutrin.
Okay. So, and I think they discharge you on just extremely low doses of like 25 milligram, which is like a dose for probably a pediatric patient.
Yeah,
Uh,
I remember it being very low.
and then I think I started slowly increasing it. I think I tried increasing it a little bit too quickly, I think, and then it didn't tolerate. So I kind of slowed it down and it kind of gradually went up to that dose. I think you're at 100 now, which is the average dose of Zoloft now. Um, and Zoloft definitely helps. But now, so that was the only thing did they discharge you on anything else or just the Zoloft?
I think it was just that. And then after speaking with you, you recommended the Wellbutrin as well.
Right. So what happens sometimes with Zoloft is that it reduces, it makes it helps with mood, but it can make people feel kind of a little bit flat, kind of apathetic, we call it. And that's when because it works on balancing the chemical serotonin. But so what happens with SSRIs is that sometimes it just, like I said, kind of incomplete results. Like I'm feeling better, but and the buts can be low motivation, low energy, low sex drive, low I just feel lack of pleasure and happy and so that's what the Wellbutrin takes care of. We're working on dopamine. And I think I've adjusted the medication dosing and but going back to the diagnosis, we might think postpartum psychosis. I think looking back, that wasn't probably the right diagnosis. you would think that because, people say, well, if I thought like passing thoughts of harming my children, that's a psychotic type of thing. Yeah, it can be, but it also can be, postpartum depression. I mean, postpartum psychosis is usually a lot more severe. I mean, you remember the woman, is it Susan Smith or someone who drove her kids into like a water and killed all her kids. I don't know if you remember that story.
Yeah.
Now that's postpartum psychosis. In your case, it was definitely milder, and it ends up because I tried. Remember, adding Abilify, and
Hmm.
you didn't do well with that. So
No.
if there was a component of that, you would have really, really liked that. Your body would have really liked that, and it didn't. So what that told me is that because I think I added that thinking like, well, let's see if we can get more complete results and let's see if the original diagnosis might be correct or not. It ends up looking back, I don't think it really was. I think that was the working, we call it like a working diagnosis. We don't really know in this field of medicine at the time sometimes. Make educated guesses, but we don't know for sure until we treat someone and follow them along and then see. Um, but yeah, it's a problem that is very common. It typically is more common after a second child than after a first child. But the fact that looking back, you see like that you thought that, well, maybe that's just normal because that was your first child, and maybe thinking, well, that's just the way it is being a mom and all that, and that's the stress of being a mom. But looking back, you see like there was early signs there, but after like a second one, it usually were. And if you had a third and a fourth, and I know you're not, uh, but if you had more kids, it would get worse every time. Which is why that mother of like 4 or 5 kids or whatever, ended up going way over the edge and actually killing her children because she had a really severe case that was unfortunately never treated. But that's nothing to do with you. That's not your story. But yeah, it's something but what's going on is with pregnancy is because when women have menstrual cycles, the estrogen goes up and down, and the hormones are kind of fluctuating up and down during the month. When you're pregnant, your estrogen level gets super high, so this is why, we call sometimes, I don't know if you experience this, but some women say, I feel really good when I'm pregnant. I felt really, really good, really happy and positive. And some people say the pregnancy glow, these women have the pregnancy glow, and that can happen. Was that the case with you or no?
I had very trying pregnancies. I don't
Mm.
know if you recall, I like very unusual, but my kidneys don't work when I'm pregnant. So pregnancy was not pleasant
Ureters
for
get
me.
pinched off, right? Don't the
Yeah.
ureters? How do they treat that? What do they do for that?
They put nephrostomy tubes in.
That's right. That's right. So they had to do a procedure to keep your kidneys functioning. So yeah, you're right. Yeah, so you're right about. I think 2 kids is a good number for you.
Yeah, I probably should have stuck to one.
Yeah, we stopped with 2 also. Um, and so, but what's going on is the estrogen level gets really high. So some women do really well, but then when you have the baby, then the just kind of a crash that happens. That estrogen level is this. And what happens when estrogen crashes after pregnancy is serotonin gets thrown out of whack, and that's what leads to postpartum depression. It often starts getting worse average about 3 months after the pregnancy. It's right away, but sometimes it's breastfeeding helps, sometimes it doesn't. Um, the good news is that if I identify it, and a woman says, I want to have another pregnancy, I'm hesitant, but I want another one. Normally, if we already identify it's a problem with the previous one, we know it's going to happen again. So I'm already ready with the medications whenever it's needed at the time. So if someone chooses to to torture themselves again. There is a way we can know that. But yeah, but that's why, and then the same reason why a lot of women will say, at the end of the menstrual cycle, they get like moody, irritable, maybe within a few days before or a week before, because what's happening with women when they ovulate, estrogen comes down slowly, and then again, just like with after pregnancy, the serotonin goes out of whack. So that's what leads to PMS, or we call PMDD. And so it's a lot of things happen with women more than men because you guys have more like hormonal fluctuations than we do. Uh,
Yeah.
and so that's why, it's more of an issue, obviously. Well, obviously, men don't get postpartum depression. So, but the good news is, like in your case, it's treatable. And if you identify it and treat it correctly, you can just live normally and, have the normal stressors that everyone else has when you have kids, but more in check then, where you're able to like handle stress better. The way I look at it is that this is being on these products, this is the real you. And people might argue like, well, it's not the real me. The real me is I don't want to be on medication. Well, I get that thinking, but the problem with that thinking is that, these chemical imbalances you can't help. It's not your fault it happened. It happens for postpartum reasons. There's sometimes genetic predisposition in families. And so the reason for this happening, you have absolutely no control over. Being on the right medication combination, like I said, puts you in control now, where you just have the normal stress of having kids and dealing, but you're going to be more present. You're going to be more, present with her as well as your kids, and like I said, this is the real you, and I'm sure that she probably says too that this is the person that I knew before.
Oh, absolutely. And um, yeah, I think after my daughter was born, I did, looking hindsight, right? I did notice signs, but I had just lost my stepdad. I then soon after I lost a really good friend. And so I just thought, I just had a baby, two important people in my life passed away, it's all this. But my depression, I was never crying. And so when I think of depression, I think of people crying, like can't get out of bed.
Right.
And that wasn't the case for me. It was a lot of it was anger. I very hostile. Um, by the time I did finally get help, I did get to a point where I didn't want to get out of bed.
Mhm.
So I think if I would have realized it sooner after my daughter was born, I don't think I would have gotten to the point that I did. Um, and like I had a friend who had a baby a day before me, and so I was like, are you having thoughts like this? And she's like, it's normal to have some intrusive thoughts, but
Mhm.
a healthy person can let it go and they move on. And I couldn't let it go. I would just obsess and I couldn't stop. And and the thing is, I was thinking they were scary. And if I didn't have the medication, I just can't imagine where I would be today.
Right. Now, is there any family history that's, parent, anyone else go through this in your family, or your parents or your mom, or
My
um,
parents know. I do have a sister that, and a nephew that, and a niece actually. They're all, I think, on some form of like an antidepressant. But other than that, not that I know of.
and looking back in your life, go back to like when you were like in middle school, like going through puberty. Do you remember any mood changes then at that time in your life?
I don't recall
Right.
that. Like I never really was like I never had like the cravings before my period. I maybe as I've gotten older, and really since I've had kids, I've noticed like before my period, I start to get a little more emotional.
Right. Yeah. And what sometimes helps, like if that happens, if you bump up the Zoloft to like 1.5, like 150 during those days, it just takes that away, because those are days where the serotonin goes maybe a little bit off, and you're at 100, the max is 200, but some people will bump it to 150 to 200, if especially if it's more than like one day, where they can identify it 3 to 5 days before, or a week before. Some women up to 10 to 14 days before, where it's, like half the month even, where they go higher on the Zoloft, and then after they go lower for a while, and they go back and down. It's kind of, but you have to be able to read your body, kind of know your patterns, kind of be able to map that out and know kind of what's going on when. Yeah, so the main reasons I've talked about this on the show a lot. The main reasons for these imbalances are number one, genetics. So running in your family, which it does. Number two, hormone changes. So that's why a lot of people, I see a lot of teenagers, because of the fact that you know that with Lauren's son, but a lot of teenagers, a lot of moodiness starts in middle school, and a lot of mood issues with puberty. And then, women monthly, postpartum, menopause, and then the third factor is stressors. And what's stressors? Well, having kids, having kids is stress. I mean, it's a good stress, because I mean, kids are great and they're wonderful and all that, but they're stressful. It's a lot to take in, a lot to do, and then dealing with the crying and the this and the that, and it's not always an easy job at all. So, my wife was a stay-home the whole time, and when my two kids were young, she was under a lot of stress.
Oh, it's definitely the hardest thing I've
Yeah,
ever done.
sure. So, and then you got to deal with temper tantrums and dealing with, all this stuff that comes with raising kids. Um, so, but yeah, but the good thing is, like I said, I'm glad you're doing well. This is, like I said, this is you that's meant to be. Um, how long to take these for? We're not clear exactly why. I'm not sure if you're worried about that. I think, the best thing is not to worry about it. At some point, we might, if we want, maybe try cutting things down and see what happens. But the problem is a lot of times when we identify these chemical imbalances, it can be a persistent issue. But I think if you look at it the right way, a lot of people take things, and don't think twice. A lot of people take a bunch of supplements and a bunch of other things, and the thyroid. I know you have a thyroid condition too, and so a lot of people will take levothyroxine long, and that's a long term. That you'll never go off of that, and that also can get thrown off by the pregnancy. Now with the thyroid, is that also? I know we talked about that before. It's gone low now. I think wasn't it high before, and now it's gone low.
Yeah, and I didn't have a thyroid issue until I was pregnant.
Yeah, there we go.
Um,
There we go.
so I think that was the catalyst there. But yeah, after my son was born, I had hyper, and then after my daughter was born, I had hypo. So I have Hashimoto's and I have Graves. So that's a lot of fun.
You're getting a lot of blood tests, I'm sure.
Yeah, I just was actually last week.
Are you on? Yeah. So I mean, the good thing about thyroid is it's something that's totally treatable. They just need to follow it, and they need to keep it from going high. But when it goes low, oftentimes it doesn't go back high again. It just stays low, and it's just a matter of replacing what your body doesn't make anymore. Because your thyroid gland just eventually just kind of slowly just stops making thyroid hormone, and that way we just need to replace it. And if we don't replace it, you're not going to feel great. You're going to be tired. You're going to think you're not going to feel good. So,
Mm,
but yeah, the thyroid's another thing that's very genetic or probably runs in your family somewhere.
it does.
Yeah, and it can be affected by pregnancies too and hormone changes. So, well, good. Well, anything else you want to share with us?
Um, I guess it's just, I'd really, I wish we could just normalize it. I had no idea how common postpartum depression is until I started being more open about it. At first, it was very embarrassing for me.
Right.
And then, I realized it's not my fault. I can't control the hormones.
Right.
And once I started sharing with people, multiple people they have come to me to say, I think that maybe I have something going on too, and can I have your doctor's name? Um, or we just are able just to talk to each other about it.
Well, that's why I wanted to have you on the show because I think this is going to give a lot of people hope, and if they see this, and again, it could be years after kids. Like I said, a lot of people just say this is the way life is. I guess it's the way I have to live, sometimes it's years past where they've just been dealing with it and not really identifying. And at least I think if we can say, okay, now it makes more sense. So hopefully, people will see this and it really, like I said, give them hope that this is something that's treatable, it's something that we can't help happen, but at least we can deal with it. And we have very good medications out there that are non-addictive and that are safe and effective. So, but I really appreciate you coming on and sharing your story with us.
Yeah, my pleasure.
All right, you have a good one.
All right,
Thanks.
thank you, Dr. Corona.
I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of the Dr. Paul Show.